I want to welcome everybody to our first virtual town hall. So be patient with us. John Skubal and I, we did not provide donuts and coffee for this meeting, but we certainly welcome each and every one of you. No doubt each of you have logged on into the meeting. You did so not to hear about the budget or transportation plan. So our special guest is Kansas Department of Health and Environment Secretary Lee Norman. If you go down to the middle of your screen, down a menu will pop up and you'll be able to see a chat button. And if you press it on the right-hand side, you'll see a chat where you'll be able to submit questions to Secretary Norman. He will cover as many of those as he can. I've also passed on to him earlier many questions that were submitted throughout the day. And we understand that Secretary Norman's time is in very high demand, and we are honored that he's here. So with that, welcome, Secretary Norman, and thank you so much for taking your valuable time to join us today. And I'll just turn the meeting over to you and until you need to go.
Well, I'm pleased to be invited. Thank you very much. It's good to see you and your constituents. Let me give you just a few brief summary comments, and then I have a list of the questions that Representative Kessinger sent me earlier today, and I'll take a whack at them. You don't know me, but you'll find me to be a very forthright person. I'm not one who minces words. I've been a doctor for 42 years. I'm an Army colonel. I just got back from 2017 and 2018 deployment, running the medical command for the Arabian Peninsula for 12 countries and 12,000+ troops, and I was the chief medical officer at KU since 2007, for a longer period than that up in Seattle, Washington. So, and I've been dealing with biothreats since 1976 with Ebola, not the most recent 2014 Ebola, but the 1976 Ebola. So I've been at this a while, and I don't say that to be boastful. It's just, I'm not a spring chicken. You can tell that from the white hair on my head, but this, I've been dealing with biothreat and significant national defense issues around biological threat for a long time. I went into the military originally during Vietnam, actually, and then I'm back in the Army after having had a bit of a break in the action, but I'm still in the Army and still serving. And but this job, this surprised me, to be real honest with you, when I signed on with Governor Kelly, and thankfully I was approved by the Senate to stay in this job. And thank you, Senator Skubal. I appreciate your support. Let me go over first some of the numbers for Kansas, just in terms of coronavirus. But I'll start off by saying, first off, we knew there was going to be another pandemic, but we just didn't know there was going to be a coronavirus. We thought it was going to be influenza. That would be the most likely, particularly an avian influenza, because we will have an avian influenza outbreak. And rather like H1N1 in 2009, Ebola to a degree, although it was dramatically different in 2014, we've been preparing for this. The thing we didn't prepare for was what we call an unmitigated health risk like this. Unmitigated to me means there's no vaccine and there's no antiviral medications. That is a game changer. We have probably not since the 50s with polio have we had anything like that. Even Ebola, we have vaccines and medications. But with this coronavirus, we have no vaccines and no medication. We put it in the context that in 2003 and 4, we had SARS, a severe acute respiratory syndrome, mostly in the Far East, came on like gangbusters, killed a bunch of people, and then just fizzled out and went away. This is the first time since then that we've had a major coronavirus in North America or in our area here. There's a big outbreak of coronavirus in the Middle East. It's called Middle East Respiratory Syndrome, CoV, which is coronavirus. I saw it firsthand in 17 and 18 when I was deployed there. And I put this in the context because you're going to ask me questions, and I've got questions here. Where are we going to go with this? What we know is that the coronavirus outbreak in the Middle East, it didn't peak out until its 4th year. So it wasn't in 3 months like we are here. The coronavirus in the Middle East peaked out in year number 4, and now year number 7, we still have a coronavirus outbreak in the Middle East and South Korea, interestingly, with that one, which is a completely different one. So this is a different animal, and we do not have anything.
For some reason it muted
I muted.
my audio.
No.
I muted.
Doctor, I can hear you.
I can hear
Okay.
you. Can
Okay,
you?
so
hang
thumbs
on.
up.
Thumbs up.
Piggy Biles, are you
Can
in
you hear
the?
him?
I can hear. Yeah, I can hear you guys. Okay, good. We'll keep going. Okay, so let me do numbers. Every day I get a paper that talks about not just our Kansas lab, but all the commercial labs that are seeing and treating patients in Kansas. And that's an important distinction. Our Kansas Health and Environment Lab is one lab in the state of Kansas. It's the one at the state. There's also 4 additional labs in the state of Kansas that are commercial labs. And anybody that wants a lab test done, it doesn't have to come to the Kansas Health and Environment Lab. We have very limited testing capacity. Quest, which is a nationwide company, has lab testing available. Doctor just has to order it. ViraCore, LabCorp, and Mayo up in Minnesota. There's those 4 companies all have commercial lab testing, and they're coming online. So when you see a doctor, for example, or any kind of caregiver, if there's a lab test done, it does not have to come to the Kansas Health.
$2 trillion direct assistance, roughly $4 trillion in Federal Reserve lending power. Again,
4 billion in lending power.
I'm not sure where that came from. I'm sorry.
That's okay. So where we are now in Kansas is we have 90, as of today, we have 98 positive cases in the state of Kansas.
98 positive cases in Kansas today.
Yeah. And it started off with about, 3 weeks ago, we had 7. And so it's just been gradually going up, which is absolutely what we had predicted that it would be, although it's a much slower rate of growth. And I have lots of graphs and charts I could show you. We compare what our escalation is. We originally predicted that it would be about every 3 to 4 days would be a doubling of the number of cases. So in other words, if you have 10 today, in 3 or 4 days, you'd have 20. In 3 or 4 days, you'd have 40. In 3 or 4 days, you'd have 80. In 3 or 4 days, you'd have 660. We have not seen that kind of growth at all, which is, I think, very good. But 98 is a worrisome number. 57 of those have been tested in private labs, the ones I mentioned earlier. 41 have been tested in our lab. We've done 2,104 tests in our laboratory. And in the total of the state of Kansas, that works out to about 4%. And these are sick people. So I bring this up because the 2,104 lab tests that we've done, which is basically all the test material we have, we always are running out. Or nearly, we haven't actually ever completely run out, but we're always right on the edge of running out. We have maybe 390 test kits right now at this moment in time. Tomorrow we'll get 160 more tests. The next day we'll get 180 more tests. And we always hope every day to get an additional shipment of the lab tests. So a recurring theme you'll hear from me is that we are not withholding any test that comes to us from a clinician. We run that test. And the reason is, and they're prioritizing, because if we ran it on every normal person without any symptoms, which by the way would have a very, like I said, of sick people who get tested, only 4% come back positive. If we had an unselected normal population of completely well people, it would be almost 0%. So in an era of scarce resources, it would not make sense from our Kansas Health and Environment Lab to use our scarce number of test kits. And we've tried through the FEMA, we've tried, the legislature allocated monies for us, but we can spend all the money in the world, but if they're not out there to purchase, you can't purchase them. So we are going to be highly reliant for some time to come, despite what you're hearing from the president and the vice president on their press conferences. We do not have access to these lab kits. So we are using them on every hospitalized patient that is suspected to have coronavirus. We run those tests. Anybody that's a first responder, anybody that's a healthcare person, anybody that's an emergency room person, etc. If we get a test result, if we get a sample from those people, we run those because we have to have our medical personnel, we have to have our first responders, and anybody that's sick enough to be in the hospital, we test those. And I can tell you at any given moment by looking at my phone, for example, I have exactly how many patients. We have 22 patients awaiting coronavirus test results in the lab, in hospitals right now at this moment in time. I can tell you on every hospital that has a coronavirus suspected patient, there's 4 coronavirus patients in the hospital right now in the state of Kansas. It'll change. It was different than yesterday, and it'll change tomorrow. What's happening to those coronavirus patients that are admitted? With the exception of 2 people, they're all recovered. Or with the coronavirus patients that are at home, how are they doing? They're either recovering or they're recovered. So 98 positive tests, 2 deaths, and the 98, by the way, is the total number of positive tests. That doesn't include that includes the number of people who are recovered and are back to living their lives, such as you can live your life nowadays with the, stay-at-home restrictions and whatnot. So I think we have pretty good numbers here. What are we doing about this? Things worry me. The things that worry me are, 1, we do not have enough test kits. In an ideal world, I would love to go check every man, woman, and child to see how many positives there were out there so that we could understand a couple key questions. And believe it or not, I have people out there that are studying China, that are studying Iran, that are studying Italy, that are studying France, Germany, the United Kingdom, Washington State, California, New York, Illinois, where they have much worse of a problem. And I know they have much worse of a problem because I have the statistics that show how many cases there are per 100,000 people. We're learning everything we can from there. And a couple of things we don't know, and this will surprise you, but it's early on in an epidemic. We believe that asymptomatic people can be infected and shed virus. It's probably young people. Older people when they get infected, they tend to be symptomatic and have more trouble. But younger people probably are more likely to be infected and shed the virus even if you don't know it. But in a world of scarce resources, I can't go out and test 3 million people. That's how many Kansans we have. So we are stuck with testing the people we have because we want to know, do they have a different treatable disease that we don't want to miss a treatable disease? Do they have influenza? We always test them. We hope the clinicians always will test them for influenza. It doesn't make any sense to test somebody who's ill, who has influenza, because if they are sick from influenza, there's a less than 2% likelihood that they're going to also have coronavirus. So not a good idea to spend a bunch of scarce resources on those folks. So what are we doing? 1, we're trying like crazy to build up our testing capacity because I feel like I've been demonized for restricting testing of people, when in reality, if I go out to the lab right now, I can look and see the 167 test kits that I have available. I'm going to have 165 people come in tomorrow, and I'm hoping that tonight or tomorrow morning we get another shipment in. But that's because that's the world we live in. But we are looking at the new technologies, and many people throughout the state and the world have approached us with various technologies where I've authorized a spend of $400,000 today to bring in a completely different testing method. It's approved by the FDA. It's not, and without going into the lab world too deeply, it has to be CLIA, which is the lab that gives labs the authority to stay in business. We will hope to get it CLIA on an emergency use authorization approved for use to use. It's called a PCR. It's a different methodology. So instead of taking 4 to 6 hours to run the test, it's about a 30-minute test. And what I'd like to do, if we can get this technology in the door, is then to set up testing stations. And I think we would probably have a half a dozen initially testing stations that if a person came in with a prescription from their doctor or a note from a doctor to say, whether it's in Wyandotte County, Johnson County, Douglas County, Wichita, Topeka, and Salina, maybe Hayes, so we can have testing stations, because we could do up to 1,500 a day. It's going to cost a ton of money, but I think we have the money. By a ton of money, I mean about $500,000 in the first week to 2 weeks, something like that. And that's if we have the staff to do it. I think we will. We only have 6 people in our lab that run these. That's the reality. We are not, the state government, we are not funded for this kind of emergency. I can tell you that. We're built for stability operations, and we're adding it on. But epidemiologists, public health scientists, laboratory people that can work for a whole lot more money in the private sector, they are not coming to the state of Kansas to work for us. So we are dealing with capacity. However, a glimmer of hope is these other 4 companies I've mentioned. I won't mention by name again, but there's those 4 companies, because now we have as many of the positives and negatives coming in the door. They're coming in from these other diagnostic labs. There is unlimited capacity. So if somebody says to me, Doc, I can't get a test, I live in Johnson County, I'll say, go to your doctor and have them order one. There's no restrictions. They have an unlimited capacity. Quest is a worldwide company. They run thousands of tests a day. We have 167 test kits right now on our bench. So you understand the strain I'm working with. So we try to protect our healthcare workers, our first responders, and then to diagnose what's going on with our hospitalized patients. And like I said, we only have, at this moment in time, we have 4 patients in the hospital with diagnosed coronavirus. We have 21 awaiting the test result. Our test result comes in 1.05 days. So Quest, ViraCore is between 3 and 4 days. And that is not good enough, because now, if you have a positive test or a negative test for coronavirus, it doesn't change the treatment. Okay, it's not like, oh, if it's a positive test, we're going to give you drug X. If it's a negative test, we're going to give you drug Y. There's no drugs. But what does it do? Well, it allows us to save the personal protective equipment. So item number 2, you've heard about protective equipment, masks, gowns, gloves, face shields. And yeah, that's on short supply. We got 2 semis in today. I'm begging FEMA. Governor and I were on the call on Sunday night at 9 p.m. with FEMA from the Emergency Operations Center, where we were all weekend, trying to get out of FEMA emergency equipment to protect our people. And we got 2 more. So we last week, for example, we sent it out on 12 counties on one day and 25 different health organizations on the next day. And met their equipment needs, but that happens every day. And so one of the things that if we can get a negative test result, back to my earlier discussion, if we can get a negative test result for somebody with coronavirus, then we might be able to spare the hospitals from using up so much of their protective equipment. I don't know if that makes sense or not, but it's those 2 things that are in short supply, and you can't pay attention to one without the other. And also, I care a lot. You know, I've been a hospital doctor for 41 years, and this sends shockwaves through a hospital and health system. I was at KU yesterday, got my temperature taken on the way in, because I was there to work with our people there that are looking at hospital beds around the whole state of Kansas, not just at KU, but around the whole state of Kansas. And I know, for example, on my phone that at this moment in time, we have 161 ICU beds available in the state of Kansas. I can tell you we have 1,028 medical surgical beds available right now at this moment in time in the state of Kansas. It depends on how you forecast. If we were truly to have a doubling of our coronavirus cases every 3 to 4 days, then those numbers I just quoted for you are not going to be enough. We are not running anything near doubling the case volumes over 2 or 3 days. So although I'm not sure we've hit the steepest part of the growth curve, to be honest with you. So what my team is doing, it happens to be at KU, but it's a statewide effort, is to look at what are the other things we can do. Example, we have 3 VA hospitals in the area, Topeka, Leavenworth, Kansas City. Each of them is about 1/3 full. What if we were to take 3 1/3 full hospitals, move all the patients into one hospital, all the VA patients, and then have 2 hospitals available? That would be a lot easier than trying to put, and I'm an Army doctor. I'm a field surgeon. It would be a lot easier to put a bunch of patients, coronavirus patients, in an existing hospital structure, have my combat medics and other people come in and staff it, than it would be to bring a MASH tent and pull up a bunch of trailers and stuff and start configuring a MASH unit when we've got hospitals that have closed in the state of Kansas. They need to be scrubbed up. They need to be staffed up with people. But it's a heck of a lot better than putting them in a tent. That's the kind of stuff we're looking at. Ventilators. We know what the strategic national stockpile has for ventilators. And the question is, do we have enough ventilators? And the answer is, depends on what your forecast says. We have plenty of ventilators now. We don't need to go to the strategic national stockpile for ventilators now. We have plenty of them. When you talk about Topeka, Wichita, et cetera, Hayes, Salina, and of course, KU, which is the largest facility. But are we sitting back and saying, well, when the you-know-what hits the fan, that's when we're going to then start sweating? No, we're sweating now. We're putting that contingency plan together now. So I got a bunch of brainiac people that have done this before, by the way. Oops.
Careful.
By the way, did you wonder what this is on my, maybe you couldn't see it. Did you wonder what this is on my desk? It looks like a little.
I did.
Yeah, okay. It's what it, good. It's because I'm going to tell you anyway. It's a pangolin. A pangolin is a spiny anteater. I could hold it up closer, but and where coronavirus came from was China. Came from Wuhan. The coronavirus has, you know, we've known coronaviruses for a long time. There's 100 coronaviruses out there. There's 4 that infect humans. But at this, it mixed the DNA curiously from the spiny anteater, the horseshoe bat. I don't have a horseshoe bat in here, but I'll see if I can find one. And then the coronavirus. And for whatever reason, that mixture of DNA has resulted in this novel coronavirus. So I guess let's talk about the last thing that comes to the top of my head, and I want to be respectful of everybody's time, and then I'll go to some questions if I haven't answered them. This stay at home, or you know, the orders to remain at home versus take care of yourself, exhibiting the good public health practices we've talked about. I personally, it's not defend in place. It's, what's the word for it? It's not defend in place. Anyway, there's orders that have been given to remain home, right? Johnson County, Wyandotte County, Leavenworth at 5 o'clock. It's already come out today for Shawnee, although there's been no cases of coronavirus here. I think Wichita maybe is going this direction. I personally think that it's a bit of a, I understand it's what they did, and I've got a chart that shows, without, you can't see it particularly, but this is the growth, this is the curve for Italy versus the United States versus Germany, France, and Spain. Maybe it will deflect the curve in Italy, what they've done with essentially martial law, but that is yet to be proven, okay? So I'm not as enthusiastic about the stay at home because, and I'll tell you the reason why, is because the exceptions allow everybody to go do almost what they want to do anyway. You know, if you want to go get your pet's tooth looked at, if you want to go grocery shopping, get gas, you want to visit a loved one, or if you want to go tell whoever would stop you, and nobody's going to stop you, that they're going to, I'm going to visit a loved one who's a shut-in. There's nothing that prevents that. to me, it's like, I remember my children never asked to be grounded, you know, and they should have been at some point in time, and I probably did actually. And I think a more productive way, quite honestly, Governor and I agree on this, is that if there's like no Sedgwick County people here, but there's that bar in Sedgwick County that even when the stay-at-home recommendations were given with all the other social distancing and things like that, which by the way is every bit as effective as a stay-at-home order. If there's a bar that's, but it was out there because I saw the stuff on Facebook, and said we're going to pack 100 people into a room that's meant for 50 people, then I, as a public health officer in Sedgwick County, would go shut that down. And I think if there's people that are blatantly doing stuff like that, and I have the statutory approval, I even have a badge to go shut that down, I would shut that down. But do law-abiding and good sense-abiding people need to be put on a lockdown order or martial law? The answer is heavens no. And I tell you, when you look at Singapore and Hong Kong and South Korea, they had a dramatic improvement curve, and it wasn't because they were in lockdown. It's because people had a social consciousness when they stayed home. They did social distancing, probably used a little bit more of the masks than we do in this country, but otherwise it wasn't draconian. It wasn't martial law. But there are people that seem to respond better to rules than like common sense. And maybe you and I can't make people have common sense. So in summary, testing is an issue. I'm not an evil guy. I really believe in testing. And thank God people have unlimited tested capacity when they go to commercial labs. Go forth and be productive. By law, the labs have to report to us because it's a reportable condition within 4 hours. So I'll know when there's positive tests. So I know when there's stuff going on. 2, are there people out there that are infected but not manifesting symptoms and are spreading? Yes, I'm sure that's true. Now we have 86 counties that don't have any coronavirus cases identified yet. Are there people in those counties that are carrying the virus? Quite possibly. Who are they at risk to? Nobody who is maintaining social distancing, good hand washing, and that kind of thing. That's why I keep coming back to this: stay at home and on a voluntary basis. And we might do a statewide stay at home order, but people are going to crash through it if you got enough exemptions to the rule anyway. You know, when I left, I was in Kansas City. I've got a place in Kansas City. I have a place here in Topeka. And so I met with the Mexican consulate this morning. It was a good meeting. And when I walked out at 8 o'clock, I thought, well, is somebody going to pull me over? You know, as somebody, because it didn't, I think it went into effect today. But somehow I slipped under the radar. And I'm not, and please don't understand, I'm not mocking anybody or anything. People are trying real hard. But I wish people in this core of their being would accept the public health principles that guide us, which is stay at home, don't put yourself at risk, especially if you're an older person or a person with underlying illnesses. If your kids are going to go to Padre Island and party on the beach and God only knows what, don't let them do that. You know, you're the one that's given them the credit card. Don't let them go do that, because they're going to bring it home and they're not going to give it to you maybe, but they're going to give it to grandma, you know. So for God's sakes, it shouldn't take an act by a county commissioner or a governor to make people use their heads and common sense that God gave them. Sir, Representative Kessinger, Senator Skubal, that's my spiel.
If I could just grab just a couple more minutes of your time.
Of course.
Dr. Norman, some of the questions that came in. One, actually, we had a couple of people ask. President Trump said, yeah, we'll be done by Easter. What do you think?
Did he say what calendar year?
Okay, that answered that question.
But let me just accentuate, other than being flippant, we don't know. And the reason, like I said, the coronavirus is in the Middle East, didn't peak out until the 4th year. What I hope for, and I should have talked a little bit more about the forecasting. I've got some brainiac people I work with who I trust. We predicted other things in the past that came true. What I hope for, let me start with that, is that there'll be some seasonality. We haven't talked about this, and this is a real key issue. I'm hoping that for a variety of reasons, it will drop down in the spring and summer and then peter out like SARS did in 03 or 04. I don't think that's going to happen. I might be tarnishing my otherwise tarnished reputation by saying this, but I think what's going to happen is I think it's going to drop down in the spring and summer, but I think it's going to come back up in the fall. And I have some delightfully scary graphs. If we say and model it out that this coronavirus is a respiratory spread, is going to act just like the 2018 influenza, 1918. What's a century here and there? The 1918 influenza, the Spanish flu. Keep in mind the Spanish flu, much smaller population back then, 100 years ago. The Spanish flu was unmitigated. There was no vaccine, there was no medication. So if we model it out after the Spanish flu of 1918, this would peak in February of 2021 would be the peak. And if it peaked out just like the Spanish flu of 1918, it would be right about 2 million cases a month in February, March, April of 2021. That is why we have to have a vaccine and antiviral medications for this. Now, if we are lucky and it peters out like 2003, 04, then what we must do is not what we did in 2003 and 04, which is to say, oh, good, that virus is gone. Let's move on to something else. Because it was no longer a commercially viable effort to build a vaccine, to develop a vaccine, because it went away. We shouldn't have, in retrospect, no, we should not have stopped. We should have, through other kinds of financial sources other than the commercial enterprise, we should have continued with the development of a coronavirus vaccine, because I think we would have been in a different place right now if we would have done that. And the fortunate thing is we've had a lot of coronavirus research going on. We have a coronavirus expert right here at the University of Kansas in Lawrence. I was giving a lecture a few weeks ago on this subject, and he asked a question, and I said, he was in the audience. I said, who are you? And where did that question come from? And he told me his name, and I said, so what do you do? He said, well, I'm a coronavirus researcher. And he said, I don't think about clinical aspects, but I do know a lot about the coronavirus. So I said, I'll make you a deal. I said, let's take this podium away and let's have a microphone and bring up a chair. I'm turning this into a panel because we've got a really good guy here that knows coronaviruses. He's the one that told me, for example, that coronavirus is finicky. It lasts about 2 hours on a surface. It cleans, if you wipe the deck with an alcohol or a chlorine containing substance, it's gone in 2 seconds. It's very finicky. It's not like some of these long lasting ones. So I invited him to the stage to speak. And then I got another question immediately from a nice older lady who was a professor of East Asian studies who has lived half her life in Wuhan, China. But she's she's a US citizen, a Caucasian woman from Lawrence, Kansas. So I said, can we have a third chair, please? So we turned it into a panel of 3 people. And she was an expert, she's a language expert, but she was also on social customs and why, when you eat pangolins or have bats in cages, where does DNA come from? So I instantly turned from a keynote speaker into one of 3 people speaking on a panel. And I'll tell you, it was one of the blockbuster things I've been a part of. Although it's very early, we hadn't even, I don't know if we'd even had a single case yet in the state of Kansas when we had this. So the forecasting is everything. When we get to 50 cases, and we got to there last weekend, then it becomes a little bit more clear as to what the forecast looks like. And again, in this case, we thought it would lead to be, and I don't like the wide margins, but it was going to be, by 31st of March between 300 and if it was unmitigated and we didn't do anything, it was going to be between 390, 900 cases for the state of Kansas by March 31st. By the way, I've not shared that information publicly, but I don't care. That's just, I haven't. So if you just put it in the middle, it would be about 600 cases by the end of March. That's 7 days from now. We're not going to hit 600 cases by the end of March. We're going to be better than that. And again, when you compare to, and I picked some states because I wanted to see some that were similar to us and some that were worse. When we look at the number of cases per thousand, we're at about 3 cases per thousand, as opposed to New York, that's up at about 55 cases per thousand. When you look at Washington State, by the way, I practiced in Washington State and Seattle. I know the health director there very well, who is managing. He's in my same role in the state of Washington. I know him very well. In Washington, they're at about 25. Louisiana, about 20. They're really having a struggle down there. New Jersey is going off the charts. Colorado to agree, and we're down at about 3 per 100,000. So we're in pretty good shape compared to them. But please understand that we need to drive this into 0, and that won't be satisfied till we get to 0.
You mentioned vaccine, does the pneumonia vaccine mitigate corona or COVID-19?
No, the pneumonia doesn't, and the influenza doesn't. They're completely separate. The pneumonia is for a bacteria, and the influenza vaccine is for a completely different virus. There's no benefit. I didn't talk about drugs. Even though there's no specific antiviral medications yet, there's a hydroxychloroquine, Plaquenil, which is an old-timey drug. I remember even back in the 70s when I was in the Air Force, I took that when I went to malaria countries. It in combination with azithromycin, which is otherwise a Z-Pak, you may be familiar with, those two seem to help shorten the shedding of viruses from the people that have coronavirus. So it's being experimented with. Matter of fact, Dan Hinthorn and others at KU and I have developed a protocol for the use of azithromycin and hydroxychloroquine. Of course, there's always people one step ahead, and they've already swept the market. And if I come out with the perfect recommendation, I don't think it's going to be very effective. But when you don't have anything that might be effective, even if it's a compassionate use, even if it's an off-label use of a drug, particularly if somebody's really sick from it, we'd use it. I would stick my neck out to use something off-label, meaning something it's not approved for, if I thought it had an iota of a chance to help somebody out. So there's not really, so there might be some existing drugs on the market, and I hope we can crank up the production to do some studies on that.
I got a call this morning from somebody who said that Z-Paks were not available. Is that what you have found?
That's the reason why.
Okay. And then we also got a question for medical practitioners, whether they should, I don't know if we call it gown up, or wear a lot of protection with a symptom-free patient as opposed to, and save the PPE for those who are showing symptoms. What's your recommendation?
Yeah, I will parrot the CDC, which says if a person doesn't have a respiratory illness, not coughing, not febrile, there's no reason for the people around that patient, to be in PPE. That's why I still don't endorse. When you and I, Joe Q Public goes out, I don't think there's any supporting evidence, and the CDC supports this, for wearing a mask. And to the contrary, masks, once you have them on for a very short period of time, they get full of moisture, and they make an ideal breeding ground for bacteria and viruses. So they actually may cause more harm than good. I don't think that these cloth masks, I love Rosie Riveter kind of initiatives to make cloth masks, although I'm not old enough to remember Rosie the Riveter. I've read books. My assistant Denise is over here snickering because anyway, I don't think there's any evidence that those masks work, but I do like the community spirit that leads to them, to that kind of thinking. But they're not approved, and they're not ever tested. OSHA certainly wouldn't approve of them. But in answer to your question, sir, I don't think that necessarily that I would recommend it. If I in a clinic, matter of fact, I was in the Middle East seeing patients down in areas where there was a coronavirus, the Middle East respiratory syndrome. I was there in 2017, 2018, and that has a 40% mortality rate. 4-0. So, and why is it hanging out there? You're asking. Maybe you're not asking, but
why is it hanging out there?
oh man, we should take this comedy routine on the road. It's because it has an animal reservoir called the camel. There's not many animal reservoirs in the Middle East, but they do have a lot of camels. And so it does seem to land in camels and then it cross-infects into humans. See, that's the issue with avian flu that we haven't talked much about. It's the issue with the pangolin and this coronavirus is because it's jumped from animals into humans. It's a zoonotic infection. That's what that word means, is it moves from animals into humans.
Well, this has been very fascinating. I cannot thank you enough for you being here. It looks like you've frozen. Are you still there, Dr. Norman?
Oh, I'm just riveted
okay.
by your speech. You're a legislator. Of course, I just glue in on what everything you say. You and
evidently have me mistaken. But we know you need to be able to get back to taking care of the entire state of Kansas. John Skubal and I can't thank you enough for taking the time and sharing it. I'm sure I speak for all the participants here. Also for the participants, we will try to copy the questions and get answers to feedback, but we need to let Dr. Norman get back to the work of saving Kansas.
Well, and sir, both of you, what I would commit to doing is if you, the constituents and interested people around here on this call, if you want to email those guys questions and they can funnel them through to my assistant Denise and I, although I'd get swamped by things, I would do my best to answer them personally because I know there's a lot of questions out there, and just try to help you. Oh, kdhe.ks.gov is a very, very good website. It's updated every day. You will have the same, it's transparent. You will have the same numbers I have. And the reason is because I think you guys need to know this kind of stuff, you, Joe Q Public, and it's kdhe.ks.gov, a really good site that's got what we call the online resources and the toolbox. And it's meant for everything from professionals that want to know what dosage of hydroxychloroquine all the way through, you know, what's the best way to wash hands. I just did a number of videos that coronavirus for questions that kids might have, because I think that kids they're little sponges that sit over there and soak up and have a lot of questions. And so I tried to do a few videos that'll each be about 2 or 3 minutes long that will hopefully resonate with kids. Just to answer some questions they have, because you know kids are funny. They'll say, "Is my mom going to die? Can I go visit grandpa?" You know, I mean, it's everything from crazy to terrifically insightful questions, and so I decided to just wrap it into something. And those videos will also be available on the website. So.
Well, for most of us, this is uncharted waters, and we appreciate you guiding us as we navigate through them. Again, Dr. Norman, thank you, and thank everyone for participating in this, and send your questions to either me or Senator Skubal. I'm at Jan at jankessinger.com, and oh, John, tell me your email address.
It is john.skubal at the Kansas Senate address.
Senate.ks.gov.
Yeah.
I got that part of it.
And Doctor, thank you very much for your time. I think that we've got the right person leading this right now, and I can't thank you and tell you how much I appreciate everything that you're doing for Kansas.
Thank you, sir. I probably would have taken the job even knowing this, but I might have wondered if I needed a sanity test.
Hey, but you got a corner office with a great view of the Capitol.
What more can you ask for?
That's
It's
right.
a tent in the Middle East.
All right. Thank you very much. And we'll sign off with that.
Okay, see you guys.
Bye-bye.
Bye-bye.
Thank you very much.